Schizophrenia is a severe mental illness that's characterized by disintegration of the process of thinking, of contact with reality, and of emotional responsiveness. So essentially it is a disease in which the thought processes are just not working the way that they should be. And they can be defined based on the main symptoms that patients tend to experience. So they're usually divided into auditory hallucinations, abnormal thoughts, and delusions. So examples of auditory hallucinations that are classically associated with schizophrenia include thought echo, where they feel like the thoughts that they're having are actually being spoken out to them. They could hear third-person voices, where it sounds like there's people talking about them, but from a third-person standpoint. And they can also develop something called running commentary, which is where they hear a voice essentially narrating what they are doing. They can also develop abnormal thoughts, so thought insertion, withdrawal, and broadcasting are the three main ways it manifests. Insertion is when they feel like they are having thoughts, but the thoughts have come from elsewhere, and they aren't generated by themselves, they're actually inserted into their brain by some other being. On the opposite is basically when they feel like their thoughts are being stolen from them, and thought broadcasting is when they feel like other people can see and hear what they are thinking. A delusion is defined as a false fixed belief held despite conflicting evidence. So that's also a major feature of schizophrenia. And all of these symptoms together come under the category of Schneider's first-rank symptoms of schizophrenia. So the way that schizophrenia develops is that initially there's a prodrome, which is usually something that's sort of observed in hindsight, really. So patients won't necessarily be diagnosed with schizophrenia during the prodrome. It's just that when you speak to the patient or loved ones of the patient, they may recall a phase when they seem to be withdrawn, they seem to lose interest in work and relationships, and this tends to be particularly common in adolescence, so in the second half of the teenage years. Then they have the acute phase, which is usually when a lot of these patients will be identified. They develop delusions, they develop hallucinations as well, and they may have some phenomena to do with thought interference. And then they eventually land in the chronic phase, which is when they end up with a very blunted affect, they don't seem to be engaging very well socially, and they have a poverty of thought. There are four main types of schizophrenia: paranoid, hebephrenic, catatonic, and simple. So paranoid schizophrenia is by far the most common, and is characterized by very prominent delusions and hallucinations, which tend to be paranoid in nature. So it tends to be associated with a sense of anxiety about something bad that is going to be happening to them. Hebephrenic schizophrenia is a type in which patients become very disorganized, and their mood and their affect is very inappropriate and can be quite variable as well. And they are sometimes described as being childlike in their behavior. Catatonic schizophrenia is a severe form of schizophrenia where you get psychomotor disturbance as a result of the mental illness. So this can manifest with rigidity or stupor or sometimes waxy flexibility. And simple schizophrenia refers to a condition in which patients only have the negative features of schizophrenia, so not necessarily having delusions and hallucinations that are quite that obvious, but they instead have negative features like social withdrawal and a blunted affect.